It is well documented that the COVID-19 pandemic has per capita hit minority communities harder than it has hit white communities. In this ONR Extra, medical professionals suggest ways to fix that and help improve health disparities in the future.
In general, Oklahoma ranks pretty low in health outcomes. As it stands right now, we are the 46th least healthy state. And so when you combine that with the health disparities or along racial lines, it really puts people of color in a pretty bad spot in terms of health outcomes.
We thought it was really important as we were getting conflicting information across the country that we take an opportunity to put forth a blueprint or a roadmap about what we can do as physicians, as a society, as a community at large to address this pandemic. This pandemic has given us an opportunity to, as a country, say this has existed for a long time, but the pandemic has both highlighted and exacerbated those inequities. When a vaccine is available, that it is available in an equitable way, that we can make sure that communities of color in particular have access to the vaccine, but also there's a lot of mistrust. And even a recent study showed that the majority of Black communities are not interested in taking the vaccine, even if it's available.
A middle class family in general, on average, is going to be more healthy than a lower class family. And upper class family is going to be more healthy in general than a middle class family. And so trying to close these earning gaps and these wage gaps across our communities is going to be important. This idea of what we call cultural competence and understanding that healthcare and treating your patient isn't a one size fits all. It's about understanding what some of those social barriers are. It's understanding what some of those cultural barriers are and meeting the patient where they are.
We know that communities of color are often more susceptible to the virus because of the jobs that they're working. They're working a lot of service-related jobs or living in multi-generational families and spreading the virus to older or vulnerable members.
It's these social economic factors that are seeming to contribute to these health disparities even more than lack of access to healthcare. Things like low income. Things like lack of quality education and educational attainment. Social factors like access to healthy foods, healthy fruits and vegetables, things that go on in a child's home as they're growing.
A lot of it is about systemic racism that we have not addressed as a country. And for the first time, we are addressing some of those tough issues. But if we all together address systemic racism, make sure that we are addressing these social determinants of health that are influenced by racism, then I think that we can make a dent and we can achieve health equity.